All right. We are answering your questions today. Today, we're going to talk about really the differences, but how to distinguish between an IBS trigger and an IBD trigger, and really having more of a conversation about it and providing you with some answers. So let's dive into what the question actually said, and we'll talk about the questions that came out as we were talking about it just now.
Yeah, absolutely. So the question we received on social media was, how do you figure out what foods are triggering IBD or IBS when symptoms overlap? There's a lot we can unpack here. But first, I just want to say real quick is for those new to the channel, I'm Danielle and we're the Crohn's and Colitis Dietitians. And one thing we also want to mention too is IBD is, of course, inflammatory bowel disease. I'm sure that's why a lot of you are here. IBS stands for irritable bowel syndrome. And IBS is a visceral hypersensitivity in the abdominal region. It's often connected with the brain as well. So there's many interventions that can help with IBS, and there is a bit of an overlap between IBD and IBS symptoms.
Yeah. And this we immediately started talking about this and talking about all that it brought up for us because there were so many sub questions. Because when we get someone with IBD who's experiencing symptoms, in that first session, our mind's going a lot of different ways to try and pinpoint what's at the root of it. Like what is actually going on? We know there's some studies will show like a 50% overlap of almost half of everybody that has IBD will have some sort of IBS as well. But we feel sort of like I was just talking about how it leaves out so much other things because, it can sometimes feel like a label for all these other things underneath of it that don't quite, the label doesn't quite address everything. So, when we are assessing someone, we're looking at stuff like, is there fat malabsorption? Is that driving their symptoms? Is there carbohydrate malabsorption, like, your FODMAPs and stuff? Is that driving your IBS symptoms? Is it related to IBD? Like, is there stuff going on with the microbiome that's impacting the overall picture? Or is it like, something deeper like SIBO or like small intestinal bacteria overgrowth? Or, there's so many details too when it comes to like gut health. And our role as dietitians is helping people get closer to the root of things to figure out what's the path forward going to be as to where we can help people with symptom reduction. And so it's a really great question. And I'm glad that they asked this because we did a previous video called The 3 Types of Triggers. And if you haven't seen it yet, definitely check it out. As we talk about, there's actually 3 different types of triggers. So there's, symptom triggers, which would be like our IBS category. There's inflammatory triggers. These are like the things that we know associated with IBD that can trigger inflammation if consumed frequently over the long haul. And then there's trauma triggers. And trauma triggers or like fear triggers are things that impact the gut-brain axis. You might have a physical fear of something that triggers symptoms. It can trigger urgency or diarrhea. Think standing in line at TSA or knowing that you don't have access to a bathroom and then that triggering fear. Those are the types of things that we're talking about. So yeah, lots to talk about there.
It is, yeah. And one thing for those watching is to understand those different types of triggers, especially the inflammatory triggers and more of the symptom triggers, because that's one way you can figure out if it's IBD or IBS related. But on the IBS related triggers is, something Ashley alluded to already in this chat, but IBS is quite often a label put on someone when they don't really know, like, what's exactly happening here. And I guess where I'm going with this is saying, chat with someone, us, to help figure out, is this IBS or is this part of IBD? And does your gut just need time to improve tolerance? Do you need certain nutrition strategies to help improve tolerance? There's also certain supplements that have potential to help with some of the symptoms you may be experiencing as well. So there's a lot, like Ashley said, that we can unpack around it. But I guess what I'm saying too is, although IBS is a really serious thing. It does exist, absolutely. There's too many times where it's just slapped on someone when they're having gut symptoms. So it's always important to understand why you received this diagnosis and that there are nutrition strategies to work through these symptoms as well.
Yeah, and I'm glad that you said that, because my fear is that someone's going to hear this and think that by saying it's a label that we're dismissing or not saying it's real, but that's not at all what we're saying. It's real. It's very real if you're living with it. And yet it's asking the question of why with IBS, like what's going on at that deeper level that we could actually modify rather than just give it a label and move on and deal with it sort of thing. Because something that I experienced working in a clinical setting previously and also working in the GI space for 10 years is that we know that the common medications used for IBS, people generally don't have good satisfaction rates with them. From a research standpoint, we've studied this too, that one, it doesn't fully address the problem typically, and two, people are not usually happy with them. And so we know that from a research standpoint, and that's definitely what I experienced in working on a broader scale with lots of people with IBS, is that nutrition can really help because it digs deeper. It's not just like, this is what it is and move on. It's like, let's get to the root of what's going on, because if your problem is fat malabsorption or you have certain triggers, that's an easy fix. Rather than taking everything out, you just modify that one. If that's the kind of answer that we get, then one, it improves your quality of life so much, and you don't have to depend on the same things that you were previously. So what I saw in a clinical setting when I did this was, when I worked as a clinical dietitian, I had several of the GIs come up and say, "What are you doing? Like, what are you doing? Because all my patients are better that I sent you." And it's not magic. It's like just digging deeper. And dietitians are really good at doing that. It's not just a me thing. It's when you're a GI dietitian, you're asking those questions. And it's just that it's not utilized enough yet on a larger scale.
Yeah. And I guess the reason I said what I said too about IBS is, in another practice that I worked in, I saw so many intake questionnaires of patients that said, okay, they have IBS. Upon talking to them, upon introducing different foods into their life, all of the IBS trigger foods did not apply to these people. That's why I'm just like, okay, find out, where or why this diagnosis has come up so that we know if it's IBS or not. Because like I said, in my previous experience, there's been a lot of just slapping it, that label on it. So, I love to hear that Ashley had such good success with people too, in helping with those lovely gut health strategies. And, for those watching, listening right now, that can be you too. There is hope out there for you to see improvement in gut symptoms, and it may just be a call away.
Yeah. I think we're an underutilized, like dietitians in general are underutilized. And some of that is, it's difficult to do diet studies and to get this to be more mainstream.
Yeah.
But we know it's effective because I worked with patients for over 10 years now. I understand that it's helpful, and I understand other dietitians see really positive results too. But yeah, we're under referred to, but I think that tide is changing. We're starting to be more referred to often, and I think it's a good thing. I think you need a combination of both to really see the results that we need to see sometimes. So yeah, let's dig further into that question. So I guess the other part of the question is around, what are the IBD triggers? Which is another question. We did a YouTube on What to Eat with IBD, where we talked about pretty in depth, like what those triggers are. And it's not just about triggers, right? It's also about what to include more of. I think we often hyperfixate on what to take out, but don't always think about the risk of not including a lot of the things that are beneficial.
If you have any other questions that are left unanswered, we highly recommend you check out our triggers video. It can be a really great thing to take a peek at to help you determine what are more inflammatory triggers for IBD.
What we were saying about how sometimes it's just a label that is put on somebody. I think sometimes other diagnoses can hide under that label too. And I think that is the other reason why it's so important to dig deeper, because a lot of times, so things that can look like IBS but maybe aren't IBS are, one, IBD. So if you're having stuff like rectal bleeding or your nighttime bowel movements or weight loss, that's a red flag that we want to dig deeper and look into colonoscopies. And also, I'd say in the IBD category, microscopic colitis is most notably one of those things, because even if you do a colonoscopy, you may not see visible inflammation, but under a microscope, you can see that visible inflammation. So that's another one. And celiac, right? Celiac is certainly one that could appear one way. Have you seen?
So many things to think of, even like a lactose intolerance.
Lactose intolerance, yeah. Fat malabsorption, which we talked about. Bowel acid related diarrhea.
Different structure of the intestine.
Right. Like what kind of things are coming to mind for you?
So what I mean by that is, like, if someone has a stricture and they don't know they have a stricture, they could have certain symptoms that pop up, like bloating, nausea, vomiting. Or even if someone has a section of their bowel removed, that could present with different kinds of symptoms as well. And all of that needs to be taken into consideration. These are all the things we're thinking of when we're talking to people about nutrition.
Yeah. And I'll also say gastroparesis. Gastroparesis is another one. So gastroparesis is where you have slower transit of the GI tract. So things are moving at a slower pace, which can even lead to stuff like nausea, vomiting, because it's so slow. Usually if people are having vomiting, that's not going to be diagnosed as IBS, but it is something to consider. If you're here listening to this and thinking, I wonder if I have these things, bring this to your GI. Have them run the test. If you think you have gastroparesis, they can run a motility test. If you think you have, there's so many tests that we want to run to uncover what the truth is. And if you're thinking these things, I think that's great, because it can even prompt your GI to maybe consider something they hadn't before. So being a part of that care team process is great. You come in as an empowered patient, you have the ideas and the tests you want to run. You're more likely to get answers faster, which is great. And with the rise of like GLP-1s, like your Ozempic and all of that. Again, what's the other one?
Wegovy. Oh,
what?
Wegovy.
So with the rise of those can actually trigger slower transit too, and can play into gut symptoms. And it particularly like the gastroparesis stuff, there is a higher incidence rate of gastroparesis and slow transit. So all that to say that IBS is the starting point. Sometimes you really kind of want to dig a little deeper and see, one, is there anything else going on? But two, what can you do to treat it? And that's where working with a GI focused dietitian can be really helpful. And if you need help, ask for it, get it, reach out, because you definitely deserve to have answers.